Hi, my name is Jennifer Moyes and I'm the Interim Director of the Cardiovascular Services. Thank you for having me here today to hear about how a standardized discharge process can reduce our 30-day readmission rates. My objective or goal today is to gain support for spreading a new, improved discharge process for all patients at St. Joseph Medical Center to improve the transition of care. I would like to see us be ahead of the game. As some of you may know, that Center for Medicaid Services is currently looking at how to reduce readmissions to hospitals. Why are hospital readmissions important? Every time a patient's care is transferred, whether it's from floor to floor or a patient going to a test or being discharged from hospital, these transition points places the patient at a vulnerable state, and the potential for a medical error is present. The Affordable Care Act established the Medical Hospital Readmissions Reduction Program, whereby beginning in October of 2012, hospitals with higher than expected readmission rates would experience decreased Medicare payments. CVU's current readmission rate is now 11%, from starting at 16% when we did this work. The national 30-day readmission rates for acute myocardial infarction patients is at 25%, heart failure patients are at 20%, and pneumonia patients are at 18%. Why is this improvement project strategic to our organization, departments, and patients? Hospital readmissions are considered avoidable costs. The U.S. healthcare system spends approximately $25 billion annually on readmissions. Reducing readmission rates is going to be vital for hospitals to survive in this economy. If Peace Health St. Joseph Medical Center implemented a standardized discharge process, we will remain physically responsible to our mission and be ready for the implementation of the Affordable Care Act and the Medicare Hospital Readmission Reduction Program. We will also find that our patients who are not readmitted have better outcomes and are more satisfied with their care, which will improve our patient satisfaction scores, and the hospital will receive the money awarded to them for meeting the heart failure 30-day readmission rates. The 5 elements of the discharge bundle that were trialed on CVU are the teach back, the discharge video, making follow-up appointments, the discharge orders, and follow-up phone calls. These 5 elements put together produce improved outcomes for our patients and keeping them out of the hospital. Each of these elements are essential for improving our outcomes. Teach back is a method to ensure understanding of information between the primary care provider or the provider and the patient or caregiver by asking the receiver of the information to teach back what was said. The National Quality Forum has identified teach back as a safe practice which improves healthcare. The teach-back goals are to identify comprehension barriers, creating a shame-free environment, and owning the concern for educational comprehension. Using teach-back creates an environment that the caregiver owns the responsibility of ensuring that the patient understands what has been taught. Teach-back is asking the patient to state back in their own words what was taught to them versus saying, "Do you understand?" During the pilot, all staff on CVU were trained in doing this. I have passed out a story of one of my nurses gave to me. It's a very powerful story and shows the importance of teach back. This is one save we had with a patient that we have potentially stopped this patient from being readmitted back to the hospital. The standardized discharge orders and patient's instructions are patterned after the physician's dictated discharge summary. The standardized discharge orders were designed to facilitate the physician's dictation and communication to the patient. These orders were to ensure that all aspects of the discharge were covered with the patient. The standardized discharge orders and instructions highlighted the patient knowing their discharge medications, knowing what the red flags are, making follow-up appointments, and knowing how to find their physician, make a phone call to their physician, making follow-up appointments. The unit coordinator makes these follow-up appointments for the patient prior to the discharge of the patient going home, and this includes making their tests as well. The nurse then gives this information to the patient and then reinforces the importance of them attending the follow-up appointment, and also ensures that the patient has transportation to these appointments. In Boston, at the Boston Medical Center, it was found while they were doing their work with Project Red that the intervention participants reported a higher primary care provider follow-up rate than the usual care participants. Discharge follow-up phone calls, making a difference one phone call at a time. These follow-up phone calls were probably the most powerful part of the discharge bundle. The follow-up phone calls reinforce the discharge instructions, the opportunity to remind the patient to attend their appointments, and also created a safe place to ask questions. Literature shows that patients who receive phone calls have fewer hospital readmissions. My staff soon were sharing stories of how they clarified information, whether it was the discharge instructions or it was around the medications. Patient and family care support. Having the patient, a video was created to show patients and families the 4 essential transition steps to take as the patient discharged from the hospital. Having the patient and family understand responsibilities after discharge was accomplished through this video. This video was created and trialed on our Joint Center transition patients. They found it to be very useful, and it also facilitated the correct conversations. I've attached the link if you would like to watch the 8.5-minute video. This slide shows the patient satisfaction data. The concentrated work during the trial was in February and March of 2010. With the staff's focus on the discharge bundle, the patient satisfaction scores started to show an improvement. With the follow-up phone calls, staff also found different ways to change their verbiage in talking with the patients. The CVU readmission rates. At the end of the project, we compared the data that was collected prior to making the changes. From February of 2008 to October of 2010, 203 patients did not receive the new discharge process, and the readmission rates was 15.2%. From April 2010 to July of 2010, 191 patients did receive the new discharge process, and the readmission rate was 6.8%. Remember that this process was trialed on all of our patients on CVU. This is a quick chart to show you how CVU's readmission rate started at 16% in August of 2009, and currently at October of 2010, you can see where we're sitting at about 10 to 11%. We did have an increase in August of 2010, and that is when we were training new staff on the unit, and we didn't have staff to make the follow-up phone calls. As soon as we had the staff again, you can see that it continued to transition back down. Implementing the discharge bundle on CVU resulted in a significant decrease in the 30-day readmission rates and an apparent increase in patient satisfaction. The results were accomplished with a relatively modest investment and process improvement. Given the current environment and declining resources and increasing nursing time demand, the barriers to implementing this bundle should not be understated. A standard discharge process supports the Peace Health St. Joseph Medical Center's vision. Every Peace Health patient will receive safe, evidence-based, compassionate care every time, every touch. By treating each person individually in a loving and caring way as they transition from the hospital to home and ensuring the patient's safety, is St. Joseph Medical Center ready for what healthcare will bring for our future? Thank you very much, and if you have any questions, I'm willing to take any that you have now.